Hi there, everybody. I'm glad you're here with us for session 3 of our data use and visualization workshop series. It looks like we might be a small group today, which is great. We can have some interaction and hear what specific individual questions you might have. Great. Nancy, glad to see that Jonah will be joining us soon. We'll look forward to having her as well. Next slide, please. Just a quick update. My name is Jennifer McKeever, and I am the founder and managing director of We Public Health, which stands for Women Entrepreneurs in Public Health. We are a collective of about 40 women consultants across the country who are working with and supporting clients and individuals who are trying to create a more just and equitable world. For today's session, next slide, we've said this for each one before, so I'm not going to spend too much time. If you are comfortable coming off camera, we love it because we get tired of looking at our own faces. And so we would welcome you to do that. And then, we're a pretty casual, comfortable group here, so no formalities. If you've got questions, feel free to raise your hand, type it in the chat, and we'll respond as we go. If at any point when we're doing some of the hands-on exercises, if you don't have access to the data sheet that you need, or you just need extra technical support, message us in the chat and we'll try to get you set up to make sure you have what you need. And I think that with that, I am going to pass it over to our lovely faculty presenters, and that would be Dr. Erica Horn and Mary Carney. So I am going to pass it over to you all to get us started. Thanks for being here, everyone.
Good afternoon. And like Jennifer said, thank you all so much for being with us today. We're super excited. I am Dr. Erica Horn. I am one of your trainers, and I'm coming to you all from Tallahassee, Florida. And I'm going to hand it over to Mary.
Hi, everyone. I'm Mary Carney. I'm based in Syracuse, New York. And you heard from me 2 weeks ago if you joined us then. But I am a huge fan of data visualization work and am very excited to be with you all here today.
Yes. And like Jennifer said, please let us know in the chats, where are you joining us from? All right. So, as we've already, we've been here. This is our third session. Over the past few weeks since May 28th, we started off with the first session. We talked about finding data, how to find different data sets using different national sources. And we spent some time aggregating and analyzing some of the different data sets that are out there. We talked about different techniques in which you could analyze the data or aggregate the data. So that's what we did in our first session on May 28th for those who were there. And then 2 weeks later, which was 2 weeks ago, we started to dive into some principles for data visualizations, which Mary led us with. And we talked about lots of different principles. How do we ensure that we're incorporating health equity principles in those data visualization principles? And we did some more work in Excel. And so now we're here at the culmination, and today we're going to be learning and working with different data visualization tools. We do remember that when we did ask everyone what tools everyone had access to, there were a lot of different tools, but by far everyone had access to Excel. So what we want to make sure that we do is present some different ideas and different ways to use the different charts in Excel today, because we know that's what everyone has access to, but we will be having a great overview of all the other tools that are available, and be able to answer any questions that you all do have about them. And with that, I want you guys to let us know, what is the single best tool you've learned about data visualization? The
Is Erica frozen or is it me?
It is not just you.
Okay, well, so let's get those in the chat if we can. What's the single best tip you've received about data visualization? That there are free tools, Nancy. Indeed, there are many free tools. What other tips have you gotten? Keep the visualization simple. Yeah, absolutely. Like we want to get all fancy with it. I know I'm guilty of that. And really just clear and simple is good. Forest, also keep it simple as well. Great. Well, I will tell you what, we're going to try to deal with our missing presenter. And I can pull up the slides if that would be helpful, Mary, if y'all just give us just 1 minute.
Absolutely. She is unfrozen.
There she is. So, Erica, some of the tips that came up were around, first of all, that there's some tools that are free, and then simplicity, keeping things simple rather than having, more visuals that might complicate things. So, those are the tips that came in the chat. Thanks, y'all.
Yes, thank y'all so much. And sorry about that. You never know how the internet's going to work these days. All right, so thank you guys so much for sharing your tips in the chat. We're going to keep it rolling along, and I'm going to hand it over to Mary.
All right. Thanks, Erica. So I'm going to review the objectives for today. Um, we are aiming to compare capabilities of popular data visualization software today as a main objective. As Erica mentioned, up until this point, we've primarily been working in Microsoft Excel, since that is the tool that by a long shot was used most widely by everyone who registered for this series. But today we're going to expand our conversation to some other popular software. And we're also going to, introduce them and talk about how we match those tools up with the data and principles we learned in sessions 1 and 2. So we'll review a lot of basic functionality up for the different tools, so you can all become familiar with a few more resources that you might use in your work. We're also aiming to give everyone some more experience creating professional visualizations using real infection prevention and control data. And lastly, we want to leave you with resources that will help you to develop your personal toolkit for ongoing IPC data communications. So that's our goal for today. The agenda, high level, is that we are in our welcome right now, but very shortly going to move into discussing different tools and software for data visualization and do a group activity using the Miro board once again. We're going to take a short break around the hour. And then when we come back, we're going to debrief the activity and move into hands-on chart creation work for that last part of the session. And we'll be closing up just around 4 o'clock. So that is our roadmap for today. We really encourage you to ask questions throughout this whole session. If you have, concerns or you're struggling with some of the hands-on work, please feel free to chat directly with either Erica or myself. We are happy to help you with anything you're struggling with as we move along, or anything you're just wondering about too. All right. So we're going to get started, and I wanted to start by talking high level about just how many tools there are to choose from. So this infographic chart you see on your slide here shows lots of logos for different data visualization software. This is by no means comprehensive, and it may or may not include some of the tools that you all are using in your work. But it's if you see along the lower part of the slide, it's generally organized to show the different software from lower to higher barrier to entry. So those tools on the left there with Excel and Google Sheets and Data Wrapper, those are, easier for people who are new to data visualization. Basic spreadsheet programs and programs where you can drag and drop your variables to create charts. As you move along the spectrum, you get into tools that have a bit of a steep learning curve, right? I've, personally dabbled in many of these, and, I've certainly found to really know the tools, it takes a lot of training at the higher end. And all the way to the right on this slide, we see some tools that are, more programming language, right? So I know just a handful of you said in registration you work in our studio. Um, we really didn't have anybody who said they work in the other software up there. Um, but we wanted to, introduce the larger landscape. And I see in the chart you're already answering the question we had for you, which was, which of these tools have you used? So lots of Excel, Google Sheets, Tableau. Forrest, you're using R and Power BI. Emily, I see also the GIS, Esri, so the ArcGIS, in addition to the ones I named. Janetta, you're using a handful. Yeah, so we know as people who love data viz, there are lots of options available to us, and we don't, always stick with the same one. Um, these software are improving every year, and the options available to us are changing a lot over the year. Yeah, so Tableau, Power BI, Excel. Thanks for sharing, Melissa. Are there other tools that you've heard of or you're curious about that are not listed here? Genomic epi data visualizations. Is that a software tool, Bernard, or just something you're wondering about?
It's not the name of a software, but I know there's things like microbe trace, I think. There's a
Mhm.
lot that help with network analysis and creating phylogenetic trees and stuff like that. But they do produce really colorful and simple visualizations that look great in publications.
Yes. Yeah, and Kumu, I see also listed here. That's another one that has great network mapping ability from what I've seen. So, there's a lot of options out there. Um, from what we saw in registration, it seemed very few of you as a collective are dabbling in those other tools. So Erica, if you want to move the slide along, I'm going to show you what we're planning to focus on today. So we can't cover all the tools today, but we definitely know every single person that we've heard from seems to be having access to Microsoft Excel and using that. So we're building on that, and focusing also on Power BI, which is another Microsoft product. A lot of you just named it in the chat. It's very similar in some ways to Excel in how you work in the tool, but we'll be talking about that. Tableau was another tool we heard is used quite a lot. That's a solid number 3 in the list of popular tools among everyone who registered for this session. And Tableau Public is the free version of that tool. So for those of you who haven't used the software because your health department doesn't want to purchase it, there is a free version available to you. And we're putting the links to all these tools in the chat. Flourish Studio is not so widely used among the health departments, but it is a free web-based tool that has many, many chart options available to you. It's a really great interactive tool that has things like running line charts and bar charts and just dozens of different chart types that are easy to create by plugging in your data. And it's been purchased by Canva. So it integrates really well with Canva, which I heard a lot of you are using as well for data visualization. So Canva is certainly more limited in the chart types it offers natively, but it's a widely used design platform that many people are using for slides and other communication work. So Flourish Studio and Canva are kind of related, but today our focus is on this set of tools broadly. And I'm going to turn things over to Erica to talk more specifically about what each of these tools can offer.
Thank you, Mary. And so you all should have received some of these documents already with the comparison charts. But we're just going to kind of go through what we learned, what we've been able to learn about these different tools. So as Mary mentioned, we're talking about all four of these new tools in addition to Excel. And so there are some universal features that can be seen across all of these tools. And we're specifically talking about with chart making and related to IPC and being able to visualize that data. And so a few things that are similar across all of the tools is that, you can easily customize the colors. There are different levels to customizing those colors, but you can easily customize your colors. It's easy to insert your data. For example, we talked about finding large data sets, but if you're collecting data in your own individual health department and you're collecting it from, different nursing homes, or people are providing information through a link for like a forms or a Google links and they're sending you data, you can easily insert that data into any of these softwares so that it can help you with visualizing your data. Some of the easier charts that all of them can make include pie charts. I know we said they're pretty, overrated for some, but a lot of people do use pie charts when you're thinking of visualizing it for the broader public and for your community members who may have difficulty understanding some of the more difficult charts. So pie charts are still going to be more useful when you're relaying information to the public most times, depending on the type of information, but also your column charts and your bar charts and your line charts. So you can find those easily in all of the different tools. So some of the things that you're not going to be able to find within each of the tools include within Canva, you're not able to do the dashboards. And I know you can probably do that more like in Tableau, but you can find a way to create your dashboards even in like Excel with the pivot tables and things, but Canva doesn't offer that feature. And neither does Canva offer the heat map feature. I know 2 weeks ago we worked on creating a heat map. So if you're wanting to do something visual with showing, the density of a certain illness or sickness within a certain area or within your state or within your county, if you're wanting to do a heat map of some sort, Canva is not going to be the best tool to offer that service. But another thing that's interesting is that when it comes to using your mobile device in order to access your data visualization tool, Excel is probably the least friendly in order of using that. Most people know if you can pick up Canva on your phone. There's an app for it. There's an app for being able to utilize it on your cell phone. For those who have like work cell phones, if your department gives you a work cell phone and you're wanting to make a quick update before a presentation, if your charts and things are in Excel, that's going to be the one that's going to be a little bit more difficult in comparison to all of the other tools. And so if you haven't been able to pick up the files that were sent to you, this is also going to be included in that resource list that we'll send out again, but you should have had it. you should have received it already. So looking at the different tools, there are a lot of different features that they all can carry. And what we're going to do is go through the different features, looking at each of the individual tools in comparison to one another. So when we're looking at web embedding, and this is to say that you're wanting to embed your data into a website, it could be your department website, it could be your EPI page, your infection prevention page. You're wanting to give updates to the general public or just your internal stakeholders about what's going on in terms of web embedding. Excel probably is going to have it has the manual workaround, so it takes a little bit more time to embed Excel into your website. Whereas with Tableau Public, it's probably going to be a little bit easier because you do have that free option. If you have Power BI, there's a pro license that makes it a little easier. And so similar with Flourish Studio, it's easily embedded into your website. Now, in terms of your interactive visuals, you are more limited with Excel, whereas the Tableau and Flourish, they're considered more interactive. And we were talking about this as we're preparing, something that's fully interactive. We can go and move your columns and your rows a lot more easily, whereas Flourish makes it a lot more easy to interact with all of the different parts of your data. You may not be able to move things around as easily, but Flourish gives you multiple options so that you can play around with your data more. If you want to, most times they'll say you want to put the year or the timeline across the x-axis. You might be able to play and say, maybe what does it look like on the y-axis? So you have more variability with Flourish to be able to interact with your data in a way that you may not be able to as well with the other data sets, the other tools that we're talking about. And then when it comes to terms of exporting your data, exporting your visualization that you created, for the most part, you can just export them all the same. So whether it's a PDF, if you want something that's like a picture that's static, that isn't going to move, if you copy and paste it onto a Word document to a PowerPoint, a PDF, as you know, is going to stay the same size. You can adjust the size based off of the corners, like you can just adjust it, but you can easily export it as a PDF or a PNG or an Excel file. The good thing about exporting these tools and these data visuals is it allows you to be able to share it, because if you have to share it with another department, another stakeholder, if you have to upload a file, if you have to upload something, it may not be the same across the different people you may be communicating with. So knowing how they receive their information is also important, because you want to make sure you're communicating with your other stakeholders and those who are going to be receiving the data visualizations that you're creating. And so having multiple ways to export it makes it easier to communicate with everyone. Now, in terms of collaboration features, this is also important depending on who you're collaborating with. So Excel is a Microsoft tool, as we know, and it allows you to communicate with those that may be in your organization. For example, you may be doing the data analysis, another person may be taking the data and creating the chart. But if you're in Excel and OneDrive, those within your organization have access to look at it. You can give people permissions to say they're allowed to view the data, they can edit the data, they can comment on the data. You can limit how much access an individual has with OneDrive. So you can allow people in your team to collaborate. With Canva, you have real-time collaboration where you can invite a person onto your team, but they don't need to be in your organization. So, for example, if you are working in the health department and then you're working on a project with a community member and you guys are both sharing the presentation that you're doing for like your city or county commission, you can share a link for Canva and you can be working from the health department side and they can be working from their community side, and both of you can be in the document at the same time. And you don't have to worry about that limitation because they're not in your organization and they don't have the same access that you have. So Canva allows you to work with other people in real time as long as you guys are sharing a link. Tableau is similar to Excel with having teams. Within teams, you are able to communicate with those in your organization. You can also invite external people in, and they're allowed to communicate with you as well within the different workbooks. And you can limit how much access they have, similar to like Power BI. And Flourish Studio allows you to share your projects. So you can have a Canva allows you, you can share a specific folder. You can create a team in Canva and you can say, hey, this is my nursing home team. This is my hospital team. This is my health department team. With Flourish Studio, you can also share just specific projects. So if you're working on one PowerPoint or you're working on one specific diagram or infographic, you can share it out like that. So I'm gonna take a pause for a quick second. I know I'm going through a lot of information. Does anybody have any questions so far? If you do, please feel free to place them in the chat or raise your hand or come off mute. I know this is a lot of information, so I just want to make sure we're all still kind of tracking. Or if you are tracking, you know, a thumbs up lets me know that you're still here, you're paying attention, you're getting what we're talking about. That lets me know that we're still here. Okay, thank you for the thumbs up, Melissa. Thanks, Shauna. Okay. If there are any questions, go ahead, place them in the chat. We're still here. And so next, I want to talk about in terms of what tools are best. When it comes to Excel, those are going to be easy. Those are going to be best for your quick visuals. If you want to do some data entry, a quick table, even if you're not making a chart per se, but you're just doing a table so they can at least see the raw numbers. Excel is going to be your quickest for that. If you want something branded, Canva has the option for you to put all of your color schemes for your health department, for your organization, and you can put all those color schemes in there, and everything that you create now is in that color scheme. So instead of having to worry about, I need to change the color, it only gives you the color options that you put in there. So it allows you to do that a lot more easily. Flourish Studio is really good for storytelling and for interactive reports. If you want to see, you know, the sun moving and, you know, to see the clouds going across the screen, you know, that's going to be really good for that. And if you're wanting to do custom visual options, Excel is limited because there's only some chart types that are available, but Canva, you can only use the templates that are provided for you. And so that's even when we talked about heat maps not being available, that's probably one of those reasons because they give you certain templates to use. You have a lot more extensive and more high customization as you go through Tableau, Power BI, and Flourish Studio. The best part, I know a lot of people are wondering, I know a lot of people said they already using Tableau and Power BI and Canva, and those are free, so that's good. And as long as you're using Tableau Public, as Mary mentioned, we know that's free. And Flourish Studio is also free as well. So with Canva, there are limited free tiers. The more, if your organization does pay for a subscription, the more they pay, the more things you get to do for free. But if you are limited, then you want to stick to some of the freer ones. And when it comes to making combo charts, the things I want to stick out, I want to highlight is that Canva is limited in that capability, but all the others can do it. And then when it comes to accessibility features, when we met 2 weeks ago, Mary talked about different accessibility features, alt text and things of that nature. So this is just to kind of give you a range of which ones are easier implemented versus which ones are not. So Power BI is probably very easy of using these accessibility features. And Flourish Studio we see is going to be the more difficult of the options. So I just wanted to quickly highlight that. And then because we're talking specifically about chart types with data visualization, I want to take a look at the different tools. Here is just a small chart. This is not all the tools as we mentioned, and this does not cover all of the types of charts, but this just looks at specifically making combination charts. We recall when we asked 2 weeks ago what it is that you all wanted to see more of or do in this workshop. Everyone, for the most part, mentioned wanting to do combo charts and I remember from the first session, people wanted to do more of the pivot tables. So in terms of making combo charts, looking at multiple different things and data at one time, I wanted to provide this chart that talks about the different kinds of combo charts that could be created. Now, recognizing that this is not an exhaustive list, this is not all of the options available when it comes to chart types. But when we're looking at combo charts with Excel, you have your line and column charts, you have multiple lines, but then also on the right side is how you are able to implement those charts in whichever tool you're using. So with Canva, as mentioned, they have those pre-designed templates. You can't really customize it with changing data. So that's why even that dashboard is not as easily usable. But the other charts, as you'll see, you can change the data and you can see the change in real time. And that's one of the things that's beautiful when you're looking at this, when you're looking at the tools. So are there any questions with regards to the tools themselves, or does anything stick out? Does anybody have a question? If not, I'm excited to. Did Mary have a question?
Oh,
Yeah,
actually,
I was.
Bernard has a question in the chat.
Oh, okay. Did not see it.
He's asking, are there any data privacy concerns when uploading data to these platforms?
Great question. And so I would say you would have to really ask your specific IT department about data privacy concerns. I know different health departments, if they do allow you to utilize them, they've already taken into account. Usually, here's the specific account they want you to use with it. And so sometimes they'll say, yes, you can use it, but you have to use our specific account that they created. So I would check to see if they already have an account that's created, if it is a free one that's available, because if it's within the confines of the contract that they have created with these platforms and tools, anything that's shared outside of that, then they're protected. So check with your individual IT departments about utilizing those softwares, the ones that are free. Most of them sometimes already have something in place, and it just may not be aware that it's available to you. But I would say there would be whatever your IT already has in place as far as data privacy. But for the most part, as long as they're allowing you to use that software, they've already counted the risk for you utilizing that software.
I'll just add that in Canva and Flourish, those tools are really, set up so that you're only importing the data that you are comfortable visualizing for people. So individual level data, or any data that you might have concerns about suppressing as a health department would not be part of what gets uploaded to those tools, because they, would only want you to upload the aggregated number into the templates to make those visualizations work. Whereas, I mean, you could set up a live stream to, several to Flourish or Tableau, but I think you would want to make sure that you have cleared the privacy bar before you do anything like that with any data, and that it's aggregated at an appropriate level. Your health department is comfortable communicating publicly.
Great question. Any other questions before you move on? If not, I'm going to hand it over to Mary, who's going to lead us in our activity.
Okay, thanks, Erica. Um, so we have an activity for you on the Miro board, which we did 2 weeks ago as well. It seemed like people were pretty familiar with that tool and how it works. We're going to put the Miro board link in the chat momentarily, and I'm going to share my screen here so you can see what we're doing. But the goal of this activity is that we want people to think through some scenarios related to data visualization of infection prevention and control data. So we have 3 different scenarios outlined on this board. A, B, and C. So if you're following me on the screen, scenario A is an outbreak response, B is about monitoring trends, and C is real-time data sharing. And we're going to have you work on these scenarios in breakout groups. So for each scenario, we've provided, pretty basic information and some sample examples of what data might be available to you. And you, as a group, are going to look at these scenarios and think about what possible findings from your data you might want to communicate. So we're going to send everyone to breakout groups, and within those groups, first off, just take a minute or two to introduce yourselves. Also, choose one person to be the writer for your group on the Miro board. So one person who's writing on the sticky notes. These instructions are right up at the top of each scenario, so you have them available to you. You're also going to choose one person to report out when we're discussing this activity. But I want you to read through the scenario and, everyone can brainstorm a key finding or something from the data you'd want to communicate. And then, add that answer into the question one. And then from there, you're going to, go down. Oops, someone removed question two from scenario two. We'll get that back for you, but there's supposed to be a question too that um, asks you to choose one of the findings and think through what types of charts or maps you would want to make to communicate your message. Um, and then there's questions related to the tools of choice. So that's that's what I want you to do, is to work through those questions as a group with one person recording on the sticky note. And we're going to work in this exercise for about 15 minutes because I know you all have a lot of experience from your health departments visualizing data for IPC. And we want you to share your experience among the group, both in thinking through chart choice and thinking through tools that you might use. So I'm seeing
Thanks,
in the
Mary. Before we
chat.
jump into the breakout groups, could you all give me a 1 in the chat if you're where you need to be? A few tips for folks that were struggling to find where we are. If you go to the top of the Miro board and you see the little circle icons next to like a video camera, if you click on either Mary's icon, which is a little green leaf, or you could click on the we icon, that'll take you to where we are. So let me see here. We've got Claudia, are you good? Dayton? Okay, awesome. All right, so I'm going to go ahead and open the rooms now, and we'll hop around and see if you need any help.
Okay. So I see your group chose to use Excel because it's simple, visuals are easy to create, minimum proficiency required, easy to access, um, all that great. But I see you said not many options for data visualizations within there.
Yeah,
So
we kind of struggled, honestly, because we kind of felt like there wasn't a lot of cons for this particular, I guess example. So, I mean, we know Excel's limited, but we felt like it was probably the best for this outbreak response.
yeah, I would agree. I mean, I think there's a reason that every health department epidemiologist who registered for this, and certainly everyone I know in the field, is widely using Microsoft Excel. It is tried and true, and certainly able to create these static visualizations you need and give you the flexibility you need for them. So. Um, I think that makes sense. I'm going to jump down to the next group that did this scenario because I think they have a lot of points to add on. But before I move on, is there anyone else from group one that wanted to chime in with something from your conversation you wanted to share? Okay, then I'm going to move us right down the breakout room, still in the purple sticky notes, to breakout room four's discussion. And you all also were looking at an epi curve, I see, and looking at Excel. So would the report out person for group four talk to me about what you thought the benefits and limitations were? There's anything new you had to add?
Yeah, we went with Excel because the quick turnaround in the scenario of 24 hours. We don't have a ton of time to be super fancy and make it the most pretty thing in the world. And Excel's really effective at getting quick visualizations when you need them. We also said how it's easy to integrate with other Microsoft products. So if we were just going to give a one pager to like management or the public or something like that, it's easy to integrate with Word or even PowerPoint if needed. And then if you're working with different types of people to where they need to see the data, but they don't need to be messing with it, you can lock some of the cells if you need to. It was harder to come up with limitations. We all love Excel. We're all used to using it. One of the bigger drawbacks was like real time or automated updates are a little harder to integrate unless you know how to do the VBA stuff. And even then, for this case, it's 45 cases over 6 weeks, so it's not a huge data set anyways. So
Yeah, I think for a small data set, that's certainly less of an issue. But you made a great point about the ability to share across organizations, and people's comfort in Excel, I think adds a lot to the value of using that software. Lots of healthcare facilities can use Microsoft Excel and would be able to get the information. So those are all great points. Anything else you wanted to add around your discussion of the outbreak visualization? No. Okay, then I'm going to move us over to scenario B, starting with breakout room 5. So this group was talking about monitoring trends across 10 different healthcare facilities. And you had some very specific ideas here of what you would be visualizing. So does someone from group 5, the report out person, want to share what you talked about visualizing?
Yeah, so we were thinking out of the different findings, which were some pretty simple and descriptive things, such as distribution of cases across all the different facilities in terms of case count. Also looking at the etiology of cases. So again, kind of looking at case count of CLABSI, C. diff, MRSA, and then looking specifically at patient demographics by facility, and then also patient demographics by organism. So for number 2, in terms of choosing one of our findings, we really wanted to narrow in specifically looking at CLABSI. And so we were thinking of looking at case counts over the 2 years and like the combination bar line graph. And then I know a lot of people here hate pie charts, but we like them a little bit over here. So we were also thinking during pie chart to look at the incidence of CLABSI between the different types of facilities, specifically looking at hospitals versus nursing homes versus the surgery centers versus dialysis center, rather than like specifically looking at all 10. And then a bar graph to show patient demographics of these cases across all of the facilities. So we were thinking Excel and Canva would be good to use. It's just something that we have more experience with. And we know that, as I mentioned, this is pretty simple data that we get with this data set. And so we know that both Excel and then displaying that data in Canva can be great. Well, when working with simple and descriptive data. They're both basic and straightforward systems and accessible. They're free. And we figure, if there's things that you're trying to figure out when working in these that you're not too familiar with, there's a lot of like resources for both Excel and Canva utilization. And oftentimes even like your own support within your facility among colleagues. And then limitations, we were just thinking really Excel graphs might not be the most visually appealing. However, in the combination with Canva, you can kind of spice things up and make them a little bit more aesthetic. And then otherwise, we can't do a lot of like sophisticated formatting. But again, looking at this data, we were thinking pretty basic and simple in terms of reporting it out. So we didn't think we would need anything that would allow us to do any really in-depth analyses or that sort of thing. So.
Yeah, Elise, thank you for sharing all that. This is great great discussion and decisions, I think, here. A few thoughts as you were talking. First, I love that you chose to focus on, really just one variable in each of your chart choices for number two. I think that goes right along with the main tip that people were talking about at the beginning of keeping things simple and not trying to overcomplicate a visual by incorporating too many diseases or too many different variables into the same chart. So each one of those was really specific. Um, the Canva and Excel discussion also I appreciate and I think that I'm an Excel lover like many of you, but I agree that Canva can take the design aspects up a notch. There's some great teachers online I've seen take Excel graphs and reformat, recolor them within Canva. And there's lots of blogs and tutorials out there if you're looking for that kind of thing. Chris Lisi is somebody I'll put in the chat who I recommend has some trainings around how to do that specifically if you're interested in the integration of Excel and Canva. So it's great. So moving us along, because I know we want to get to hands-on exercises, I'm going to go right up to group two. So why don't someone who is the report out person from group two talk to me about what you wanted to do with the monitoring exercise with your healthcare data.
Hello, this is Nancy. So the data we wanted to look at, like number two or the second box, was who was most affected by the HAIs by race, gender, and age. For that equity piece, we are using thinking bar graph, well, simple epi curve like most people have talked about, but also the bar graphs. So our stakeholders outside of these facilities would be easy for them to visualize and understand without a lot of explanations. We picked Excel just because our whole group uses Excel, and that's the one we're most familiar with. Although we'd like to play around with the Power BI because looking at the comparison chart, it looked like it could do a lot. And then why Excel? Yes, because we're familiar with it. It's included with other software, easy to share outside of our organization. And like other people have talked about, the limitations, there really isn't a lot of limitations. We just decided interactive visualization would be one of the limitations.
Yeah, that's a main drawback for sure. Thank you for sharing all that, Nancy. This is, it building on what people said. I know you had a lot of, the same thinking around Excel, but I really, think I like that you introduced the Power BI as a possibility too. So we we're comparing these tools in preparation, or the tool comparison in preparation for today, and did want to point out that Power BI has more of the built-in accessibility features than Excel. There's a lot of, manual adjustments that we made 2 weeks ago when we were formatting our visual within Excel to help make it have that alt text and be more clear for people. Power BI has a lot of those, same same functions as Excel does, but some things are a little easier. So it has built-in color contrast checker. It gives you the meaningful text hierarchy a little easier. So there are some things worth exploring if people feel like dabbling in Power BI at some point. So I appreciate you bringing that in. I want to get us through this last one too. So, last but not least, we have real-time data sharing. So, breakout room number 3. Do you want to talk to me about what you decided to do for real-time data sharing?
Sure. Hi, this is Janetta. So we talked about using Tableau since it's going to be a public-facing dashboard. And so we were going to do the epi curve, highlighting because the data available is the daily case count. So we were going to do the epi curve with that. And then we thought also highlighting the vaccination rate would be something we'd also want to highlight. And then some things with Tableau, some limitations is the cost, it's expensive, training, education using Tableau, but some of the benefits, it's really good at making data visualization charts and everything. You can have it be interactive. And then you can also put like tooltips in it and the charts and graphs and things like that.
Yeah, I think those are all good points. Tableau public is freely available, but as you said, it does have a bit of a learning curve, and it's not a tool that you can easily jump into and create something from if you don't know your way around in there. It does have a lot of documentation available online, and there's lots of great community that's learning to use Tableau and teach people about it online. But it is one tool that requires an investment of your time and attention if you want to create those interactive dashboards. Um, any other thoughts from your group's discussion that you wanted to share? Okay. Well, thank you, everyone. I really appreciate everyone's engagement in this exercise. I know there's a lot of good thoughts within this group about how to visualize data. So I'm glad we all got the chance to engage with this. I'm going to turn things over to Erica because she's going to lead us through our next part here.
All right, everyone. So now that we have been able to do such an amazing activity with each other, we're going to lean into our own practice of making some charts. And so at this time, I would like everyone to pull out the data file that they should have received in your email. If you did not receive that, the link to it will be shared in the chat. It is a lot smaller than the file we tried to use that first workshop that may not have made it to everyone, but everyone should have access to this data file. If you could let me know once you have it by doing a thumbs up or place it in the chat, like, yeah, Y for yes, I have it. So I know you have it. And I'm going to pull mine up and start sharing my screen on that data file. So, yay, I see lots of Ys. Yay, I see lots of thumbs ups. All right, so everyone has this data file. Uh-oh. Let me pull it back to the data file. There we go. If you need any assistance with getting the data file up, if you don't have it, please place it in the chat. And what I want us to do is we're going to take some time, spend some time looking over this data file over the next few minutes. We are going to make So we asked everyone, what is it something that you all wanted more practice with? And we wanted to make sure that we were taking into consideration what you all wanted to do. And so the two things that we heard back, feedback was more practice with using pivot tables, because we did go through that really fast the first workshop. And then also with making combination charts. And a lot of what you guys talked about, and just even the example that the activity you guys previously just did was, saying you'd want to do a combo chart of certain things. So what we plan on doing today is spending some time and making a combo chart. In this chart, at the bottom, there is a section that says, one of the sheets says combo chart instructions, and they're pretty high level so that you can take them to any kind of data set that you may have. And high level in the fact that it may not necessarily say specifically take this variable name or telling you which rows to take. You can choose which ones you want to use when you're looking at your data sets. So what I want us to do is first take a look at the data itself. There are multiple columns. We have our columns A through I. This one says A has state. We notice that if you go down, you see United States. The filter button should be on already. But you'll see, like, if you click on it, you can see all the states that are represented, possibly that are in this data set. You'll see similar things for sex, for age group. And I just want us to take a moment first, and you can either come off mute, or what I want you to do is place in the chat what kind of stands out at first glance when looking at just the data set itself. If you were to scroll through, what stands out when you're looking at the different categories for age group? Does anything stand out? Or not does anything stand out? What stands out to you all when looking at these different groups? Are there any unexpected groupings or any unexpected gaps? Or what do you think might be missing if you're just taking a look at this initially? I'm going to zoom in a little. I also recognize that everyone may not have access or may not be able to see both screens at once, so I'll zoom in a little bit more. If you guys need, does this help? Thank you. So does anything stand out in any of the categories so far? Looking at sex or age. So this data set, I will preface, is COVID-19 deaths data that was made available through the CDC. The things that are missing that we would have loved to work with are the timeframes, the dates of these deaths. And so that is one thing that is missing. We do have a few limitations, even with some publicly available data that is available to us. But knowing that the timeframes of when these deaths occurred is missing, I want us to take a look. Okay, so Emily says there are age groupings that overlap with each other. Yes. Why does that kind of stick out with what do you think that does for you as a person that's trying to visualize data if you have overlapping age groups? And similarly, even with sex, you have all sexes, but then you have some that are just male or just female.
I feel like you'd really have to dig in to figure out what like for specifically looking at probably like the United States data and see what age sets are part of that data set versus are there different ones at the state level, or if they're all the same, and then figure out like which ones to use because they're overlapping.
Yes, no, that's a great observation. That was one of the things we were talking about when we were like, well, which age groups are we going to use for the example, right? So yeah, there are overlapping age groups, overlapping sexes and states. So we're gonna go because I'm in Florida, we're gonna go with Florida, right? So that's what we'll do today. And so knowing that we have different age groups, different sexes, and then the categories of COVID-19 deaths versus your total deaths versus pneumonia or categories of pneumonia and COVID, or influenza alone, or all three that could have happened all at the same time. So that's what this table shows. So what we're going to do is start with a pivot table, and from our pivot table, make our combo chart. And we're going to see how you can, as you make changes to the pivot table, how that can possibly in affect or change your combo chart as you're making it, as you're exploring it. What we're doing also is exploring the data because we see what's available. 2 weeks ago, Mary talked about explanatory and exploratory data. And so what we're doing is looking to see what is available and how we can visualize it based off of what's there. So this activity is going to be you all coming off mute, answering a few questions to see what it is you want to do. And so the first thing I want us to do is, in order to make our pivot table, a quick way is to highlight all your data, of course, by hitting the arrow at the top corner. And then you're going to hit Insert and Pivot Table. And I want us to click on New Worksheet and click OK. And then from there, what data do you guys want to look at? What would be interesting for us to compare? Do we want to look at, Emily already mentioned age group, so I'm going to just click age group. Do you guys want to see it by state, or would you want to see it, yes. Do you want to see it by state? Do you want to see it by sex? Do you want to look at all of the US? Do you want to look at what things stick out that you want to include? And you can just place it in the chat what would be interesting for you to look at. One thing I want to highlight is there are multiple ways to use your filters in the pivot table. So on the right side where your pivot fields are, you can pick your filters there. So for example, I already said I know we want to look at Florida data today. So I can use the arrows there. And deselect all and click Florida. But would you all like to look at a different state, or would you all like to stay looking at all of the Florida data or all of the US data?
Erica, I say just choose something and talk us through it. We're not getting any input in the chat.
All right.
If there is something y'all want to look at, you just let us know. But otherwise, Erica, I say you just make some choices and talk us through it.
That sounds good. So what we'll do is we're going to look at Florida data. We're going to look at age groups. And Emily mentioned about the overlapping age groups. So since this was COVID-19 data deaths, let's say we're going to look at COVID-19 deaths. Going to add that. And then we also want to look at, let's say, flu deaths. And seeing what we could potentially make with that. And with that, if we're looking at our combo chart instructions as we're dragging the variables that we want to see, we have age group and we have our state in our rows. And then we also, I think we should take a look at the total deaths to see if there's any comparison, what they all look like in comparison to the total deaths. And so there are multiple ways here when you're looking at your pivot tables, how you're moving the variables. And so this way allows you to filter by your row labels are here, and we have all the age groups on the left-hand side. If I'm working in a specific, let's say I'm working in a nursing home, I may not be interested in all of the age groups. So one thing I can do is I can filter the age groups on this side. And if I'm only interested, let's say we're interested in working with those over the age of 65, I may deselect all of them and only click those over the age of 65. So we have 65 to 74 years, and then we can also do 75 to 84 and 85 and over, because that's who we may be working with, or that's the populations that we are working in. So I'm going to select OK. And now my age groups are just those in Florida over a certain age. Now, if I'm not interested, let's say I wasn't interested in flu deaths, but I'd be more concerned with pneumonia because of the age groups that I'm working with. I can add pneumonia. And it's like, okay, now you're seeing all of the deaths that are occurring in this time frame. So if we're looking at our instructions, we've moved over all, the different variables we wanted to add. We've created our pivot table. And so now I want to say, well, what kind of chart do I want to show to share this information with other people? I'm on sheet 2. And so a quick way to do it, instead of recreating another table, you can highlight your data, and then you can go to insert from here, and then you would select your recommended charts, and we're going to select combo chart. And when we select combo chart, we see multiple options of how the chart can be created. This is going to create a clustered column and a line chart. So we want to say, well, what do we want to actually see as our line? Most times you'll do your total deaths as your line, and when you're looking at clustered columns. And if I were to do that and I just hit, this is all of the data, I want the total number of deaths possibly on its secondary axis on the right-hand side. So I could see the numbers on the right-hand side versus the left-hand side, just so there's different axes. So we're just playing around. We're just looking at the data to say, okay, what is it that we see? What is available? What do we want to talk about? So here, this is showing us the deaths, the sum of the deaths for your COVID-19, your flu, your pneumonia, your total deaths. This is in the state of Florida. This is for those over the age of 65, and you see the 3 different age categories for all of them. Now, let's say you're interested, you're saying, well, I'm not really interested in only Florida. So now I want to say, I'm interested in seeing what the numbers could have looked like for the whole country. I would redo my filter. And now I can go all the way down and select United States and see if there's any difference. When you're looking at the data or exploring the data with your pivot tables, you're allowed to see what trends or what differences come about in real time. So me selecting United States is going to change the table immediately. So let's say, oh, okay, well, what's going on in another state if I want to see what's going on in Georgia compared to Florida? Then I might say, well, we're really close to each other. Maybe I want to see if there's any difference there. So now I may click Florida and Georgia, or unclick the United States, or see what it is in comparison to the United States. Now, of course, we talked about data visualization tools. So we may not, when we're looking at it like this, we're like, this sounded like a good idea, but now that I make the chart, it's not really giving me, it doesn't really look that good. So as you're using your pivot tables to make changes, as you're using your pivot tables to look at the data overall, you're able to see, this is a great way to look at, okay, this doesn't look visually appealing, some of the things we talked about and the limitations within Excel. So what can I potentially look at now? You'll say, okay, all these numbers look really high in comparison to the US. Maybe I don't want the US overall in there. And then you go back and say, well, I don't want to see it compared to, I only want to see it in Florida and Georgia. And now you're able to see what those numbers look like. Then you may also say, well, I'm really not interested so much in the flu deaths, but more of the COVID-19 and pneumonia deaths. And you can easily deselect influenza and see what it is for each one over all of the years, or there's one that's already comparing all to both of them together. So whichever you prefer to do, you have a choice in whichever way you want to do it. So we're going to go back to saying we're in Florida. We're looking at Florida deaths. So I'm going to deselect Georgia, and we're going to look at just the pneumonia and the COVID-19 side by side. And now we're saying, okay, this was almost, no, I want to keep the total deaths. Our chart has changed. So you notice once we changed the chart, our line disappeared. And so if you're ever in a position and you're like, I did want to do a combo, when you click on the chart itself, you go to your change chart type. And now you can go back and select combo again. And you can say you want your pneumonia deaths to be your line and your COVID-19 deaths to be your cluster column. You decide which ones. You can change it up and say you want your pneumonia to be the column and the COVID-19 to be the line. And it would change based off of what you want it to be. So let's say this is what we wanted to do. Now we want to give it a title, but we see all these little gray boxes around, and we're like, we don't want them visible on our chart as we're preparing it. So you can right click on your chart area, and there's a button that says hide field list. I'm not sure, didn't mean to hide that one. I meant to hide the fields. Oh, wrong one. Click on your gray, and then you're gonna hide your field buttons on your chart and your value fields. And now those go away. You're going to still add your title and a chart title. And so in this chart, we said that this is COVID-19 and pneumonia deaths in adults over 65 in Florida. Because we know you wanted to say, or you want your title to kind of tell what your chart is about. And so that's what the name of our title of our chart is here. And so this is just one of many ways that you can utilize your pivot tables in order to help you make your combo charts. You can still play around with the data other ways, depending on what variables you have available to you. If you wanted to add sex, if you were to say, I want to see male versus female, and then you added, you could filter in and say, okay, I just want to see males and females, and then I want to add sex in. Now it's doing it by male and female. So as you're continually adding things to the chart, as you're continually adding variables in your pivot tables, it allows you to see the data in different ways, and then you can make the decisions of what stories you want to tell with the data that you have available, especially if all you have is data and you don't necessarily know what you're trying to share with others yet. This allows you the ability to look at your data and explore it in a way visually as you're making those decisions before deciding what needs to be made or what data needs to be told. Are there any questions about any of using the pivot tables, of creating combo charts with limited data? Are there any questions so far?
Erica, I have a question for the group and maybe Mary too. I'm wondering about thinking about what we learned about telling a story with the title of your data chart. I'm wondering, like, what's the story here, Mary, or anybody on the line? Do you have any thoughts about, what could the story be that we're telling here in terms of a title?
Well, when you break the data down by sex, it's clear we have, more deaths in the male categories compared to females. So in the 65 to 74 and the 75 to 84 age group. So, that's a story you could pull out and focus on. Um, the other data, it I often use the pivot tables to find the stories. So this is where I explore my data and find where the differences are and what messages I want to tell.
Mhm.
I think combo charts are a little tricky, but it's a good question. Um, what what chart titles would work for people with this one if they wanted to, communicate to a group?
Just curious.
Mhm.
Great question.
Yeah.
Great question.
Erica, I'm not sure if you want to use the polls, but just letting you know they're there if you need them.
Yes, so we are about to actually transition into the polls. Are there any other thoughts or ideas around what other information they would like to visualize or see with the current data that we have up? You are able to use this data. I would really love, yes, please take it now that you're able to see different things. Like, how would you play with the data? How would you play with the pivot tables? You have the data file, you have the instructions, and you can see how you can make different charts or just to look at the data and use this for helping you with your storytelling. How do I tell stories with data? And hopefully this was able to help you in realizing the power behind using the pivot tables and how they can help you decide what stories are powerful or stories are meaningful for your department. And so we're going to actually, I didn't mean to do that. We are going to, I have a few questions for you all. So based of the data set that guys have, the poll is going to open up, and I want you all to just answer the polls with your answers. So the first question is, how would you prefer to visualize total COVID-19 deaths by state alongside the percentage of deaths in the 65 and up age group? A, using a pivot table with states as rows, age groups as columns, and death counts as values. B, to create separate columns to calculate the percentage of deaths for each state and then chart it. Or C, would you like to combine both raw counts and percentages into one table to support a combo chart? So the polls are open. Go ahead and answer, and we'll give you guys about a minute and 30 seconds to share. How would you prefer to visualize this data? Okay, I see some people coming in the polls. We'll be closing the polls in about 25 seconds. Few more answers coming in. And 5 seconds will close. I think that, oh, we got one more. All right. So everyone sees the results on their screen? Is it sharing? Okay.
Give us a 1 in the chat, please, if you can see the results. Great.
Okay. Awesome. So can someone who said, so overwhelmingly, well, not overwhelmingly, more people said that they would create a separate column to calculate the percentage of deaths for each state than chart it. Someone who said that, why did you choose that option? If someone could come off mute.
This is Susan. The reason I chose it is because I felt like it was cleaner.
Okay.
Just maybe it's really hard to visualize, honestly. It'd be maybe better for me if I had a picture of each one, because then I feel like you'd go right to the one that, that made the most sense, but that's why I chose that one.
That makes sense. That makes a lot of sense. Could have had pictures. Great. Thank you. So I have two more questions, and the next question asks, should we visualize all age groups on the chart or focus only on a group like 65 and up or children under 17? And so that poll should be coming, it's open now, and choose what you would do. Would you A, focus on a specific age group, B, include all age groups for full context, or C, could create multiple charts to compare different groupings? We have about a minute left to think about which one you would do, unless everyone answers sooner. I have about 10 more seconds. Which one would you do? All right, and we're gonna close the poll. And everyone sees, I think everyone thumbs up if you're seeing the results on your end. So this one, we had a split. So about 40% of you said that you would focus on only one specific age group, and about another 40% said they would create multiple charts. So someone who said that they would focus on a specific age group, if you could please come off of mute and share why you chose that one and which age group you would focus on.
This is Nancy. I would look at the first one because I want the high risk group that I would work with, and that would be your 65 and older.
Great answer. I love that. That is something to consider. Who's more at risk? So if you had a choice of multiple options and it could have been any variable that you had, going through the pivot table can help you see, okay, this is the one I need to focus on. They're more at high risk. Someone who said that they would create multiple charts to compare the different groupings. Can you come off mute and share why you chose that option? There were four of you. Somebody said it.
I always like having comparisons, so I usually bias towards that a bit. But also you can see if there's any, I mean, it shows when there's outliers. If the general population on most of your are pretty low and then one of them spikes, that's another way to know to focus on it.
Awesome. Thank you for sharing that. Thank you so much, Forrest. And then we have one more question that I would love to get your feedback on what you would do. And the poll is, if some states have very low death counts, should they be included in the chart? So let's say you're doing a chart of all of the US. A, yes, include all states for completeness. B, no, exclude low count states to avoid visual distortion because you don't want it to mess up your chart. Or C, only include states above a certain threshold. So are you looking at only over 100 deaths, over a certain amount? And the poll is open, so let us know what you would do. think there might be one more answer out there. I'm about to end the poll in about 5 seconds. Oh, there we go. All right. So for this one, we had 5 people say that they would include all states for completeness. 2 said that they would not include the low count states, and 4 said that they would only include over a certain threshold. For someone who said that they would exclude the low count states and they said they wouldn't include them, can one of you two come off mute and share why you would do that? Or if you didn't mean to put that option? Well, I'm gonna let you think about it a little bit, but if someone who said that they would include only over a certain threshold, could you share why you would do that and what do you think a reasonable threshold would be? Who chose the last option?
Y'all are making us work for it here. I think if you don't mind sharing, it helps your colleagues on the phone just understand what your rationale was. So less for us, more for the colleagues on the phone. Who chose only include states above a certain threshold?
We don't see your names.
Can you hear me?
Yes.
We can hear you now.
Okay, sorry, my
Thank
audio
you, Melissa.
is not great. Like just depends on the story you're trying to tell. If we're only focusing on high counts for deaths, then I would want to create a threshold to be like, look, these are the ones with the magnitude of problem that I'm looking at. You know, the epi in me says you actually shouldn't be using raw counts and you should be doing, age adjusted death rates, but that, the common person doesn't understand that. So, knowing who your audience is and what you're trying to convey is good. And I think having a more standardized, for the story I would tell, having a standardized, like, I'm going to only look at this, kind of helps a more clear understanding of the data and story I would tell.
Thank you so much for sharing. Thank you so much for sharing that. Are there any does anybody else would like to share? If anyone who said yes, they would include all the states, would any of you like to share why you would do that? Or are there any other additional thoughts or questions around this question, this polling question? Feel free to come off mute now or place it in the chat. The chat
Who
is still.
wanted to include all states for completeness?
This is Emily from DuPage. I picked that one and I was thinking, I like how sometimes CDC will do like a graph or a map, but then have an accompanying like table underneath it. So like if it can be hard to sometimes see something small in the graph, but you do want to include everybody because like just because like Wyoming didn't have very many deaths, you don't if it's the type of situation where you don't want to just exclude them because they don't have that many people. That's what I was kind of thinking is like having possibly like a combined type of thing with like a table underneath where you like with people they could go and find their state or something like that. But to echo Melissa, I would also calculate rates so then you wouldn't have the magnitude, or you would be less likely to have like the magnitude problem with the counts.
Got it.
Yes, thank you so much for sharing. And so if you have any other questions, feel free to place them in the chat. And I'm going to hand it on over to Miss Jennifer.
Thanks, Erica. Thanks, everyone. So we have one final poll for you, and Mary is putting a link to that in the chat right now. We're going to take you back to the Miro board. And once you get into the Miro board, just click on that link that Mary shared. And once you get to the Miro board, I'm going to bring you all to where I am. Bring everyone to me. And some of you are familiar with this, and we did it in a Slido last time, but this time we're going to ask you in the Miro board. Tell us what's one thing you liked about today's session? What's one thing that you wish could have been different about today's session? And what are you left wondering? So as you walk away from today's session, what are you left wondering? And if you don't mind sharing those, what that does is helps us when we're compiling the resources that we're going to share with you after the webinar. And so we can make sure that we're addressing any outstanding questions that folks have. Okay, good feedback so far. Mhm. I think one piece of feedback I have for us is it seems like Miro board works pretty well for folks. You can let us know how you feel about that. While you're adding your last thoughts, I'm just going to say thank you so much for being here with us. You all are like you stuck it out till the end. I think the thing that I learned here is that there isn't a right answer for the best data visualization, right? That seeing those polls where everybody had a different kind of take on it, it was pretty evenly distributed, and there's not a right answer for that, right? It's an art and some creative thought into how to share this data with folks in a way that's going to have the impact that you hope it will have. So we appreciate you. And again, thank you so much for your time. Thank you to our faculty, Mary Carney and Dr. Erica Horn. And I hope y'all have a great rest of your day. We will be following up with some resources as well as a recording of this if you would like to have it. So thanks everybody. Take care, and we appreciate your feedback in the Miro board. We'll see you soon.